Hi everyone, my name is Samantha and this presentation is on compassion fatigue. First, let's start off with some learning objectives. At the end of this presentation, the learner will be able to do the following. First, accurately define and summarize compassion fatigue. Second, describe the impact that compassion fatigue has on both nursing practice and healthcare as a whole. So what is compassion fatigue and why is it relevant? Compassion fatigue has numerous definitions, some more wordy than others. In Jan Lanier's Running on Empty, Compassion Fatigue in Nurses and Non-Professional Caregivers from 2017, compassion fatigue is defined as the physical, emotional, and spiritual result of chronic self-sacrifice and/or prolonged exposure to difficult situations that renders a person unable to love, nurture, care for, or empathize with another's suffering. More simply put, it's the declining empathetic ability from repeated exposure to other suffering, as mentioned by Contreras, Salazzo, and Esposito in their 2020 journal entry in the Journal of the New York State Nurses Association. So, what's the relevance of compassion fatigue? Compassion fatigue is important to recognize and keep informed about because it can affect anyone. Lanier mentions in her journal entry from 2017 that roughly 6 to 8% of nurses experience compassion fatigue. Certain areas are at higher risk, but that doesn't exclude other areas of medicine. According to Mattioli from 2018, some of the specialties that are at higher risk for compassion fatigue include oncology, intensive care or emergency medicine, mental health, pediatrics, and community health. This graphic here kind of symbolizes pretty much what compassion fatigue means in layman's terms, just that your personal tank, as you hear people refer to it, is on E, it's on empty. You have essentially nothing left to give. All right. Influence of compassion fatigue on nursing practice. Nurses experiencing compassion fatigue can place themselves and their patients at risk, according to Henson in 2017. It causes increased stress, anxiety, fatigue, sleeping difficulties, irritability, impulsiveness, fear, insecurity, emotional isolation, depression, sadness, and sometimes avoidance. All of these can lead to increased errors, more use of sick days, and less presence at work, according to Mattioli in 2018. Of course, this then has an impact on healthcare. Compassion fatigue can increase turnover, which leads to short staffing, newer nurses with less experience, which can also influence patient outcomes. The nurses that are experiencing compassion fatigue and are staying can have less sensitivities to patient experience and preferences. This can also have increased costs for healthcare systems related to time off when a nurse needs to take some time to kind of regroup and regather, increased costs for hiring for those nurses that have left, and of course increased costs related to the increased errors. In addition to healthcare, it has an impact on society. Compassion fatigue profoundly affects mental health status. This can lead to anxiety and depression, which drastically affect home life and can cause a disruption within the family dynamic. There can be a lack of involvement with family, friends, community, and societal gatherings. There can also be an increased need for therapeutic support, along with increased knowledge for coping mechanisms. Some final thoughts. Compassion fatigue has a drastic impact on oneself. There are emotional effects, physical effects, spiritual effects, and work-related effects. In addition to just oneself, this can impact patients, coworkers, family, and friends. And remember, you can't pour from an empty cup, so you have to take care of yourself. That's kind of the the biggest takeaway with compassion fatigue is you have to first take care of yourself before you can adequately care for others. This slide here is just all of the references that I used for this presentation. Thank you so much for watching and listening.